Summer is almost here when we all live in lighter and fewer clothes, and we all look at that problem fat that just won't seem to go away, no matter how much diet and exercise are involved. But there is a fix for that fat. It's liposuction and has come a long way, and there are now a number of lipo options out there if you're interested. And here to sort it all out for us is Dr. Alberico Sessa from Sarasota Surgical Arts. Good to see you again.
Hi, Heidi.
What is liposuction?
Well, it's exactly what it sounds like. Liposuction is where we infuse the body or the areas with fluid, and then we remove it. Over the last 15 to 20 years, there's been a lot of changes in liposuction. It's become a lot safer. Not that it ever wasn't, but the majority of liposuction can be done under just local anesthesia without the need for anesthesia at all to go to sleep. In the past few years, we've seen the occurrence of something called laser liposuction, as well as ultrasonic liposuction. These are all techniques to help shrink the skin and break up the fat so that it's more easily removed without having it to be a rigorous activity.
Right, okay, so laser, ultrasonic, and also suction assisted. That's the first kind, is that the...
Yeah, that's the kind that's been around all the time. In order to remove the fat, we actually have to take it out under vacuum pressure. We don't just break it apart and then the body reabsorbs it. To a certain extent, that happens anyway. But most of it, especially in bulkier procedures, it has to be suctioned out.
All right, now what about the effectiveness of it? Should anyone just go and have lipo and then is it gone forever, or is this really a serious situation that you have to consider carefully?
Well, as always, any surgical procedure you have to consider very, very carefully. But it is for just about everyone. We don't recommend liposuction as a weight loss. We recommend it. The ideal patient would be somebody that's just looking to contour certain areas, maybe their stomach, maybe their thighs, maybe their love handles that they just doesn't go away with exercise or diet. And in those patients, those are the ones that really see the greatest results. If it's just for debulking tissue and just to remove lots of large volumes, we really don't recommend that, and it's not quite as popular as it was, say, 20 years ago or 25 years ago, where large volume debulking procedures, it's mostly, liposuction has sort of come into the boutique era where, small areas bother people. I want, the curves of my hips to be more pronounced. I want my stomach I want to see the muscles in my stomach more. It's not, you don't have to be fat to have this done. You could have little localized areas, and it's great. And a lot of times we do these procedures just under some simple lidocaine, which is just some numbing medicine.
And what about recovery and how long this lasts?
Well, any type of surgical procedure is going to last for as long as you take care of yourself. But, we would experience the normal postoperative period of 2 to 5 days of some mild bruising, some mild swelling. Depends on the areas that we treat, but if it's just localized small areas, you may experience very little discomfort and very little postoperative edema.
And I thought it was very interesting what you're doing with some of the fat that you suction out, and we're not going to talk about that right now. I'm going to show you that at 6 o'clock. We went to Dr. Sessa's office last week, and we saw some of the interesting things you're doing with fat grafting. So if you want to see that, check that out tonight at 6. And thank you so much for coming on.
Thanks again, Heidi.
And if you'd like more information about this, just go to our website, mysuncoast.com, and click on My Suncoast Health, and that's where you'll see the link to Dr. Sessa's Sarasota Surgical Arts.